Hey folks, it's Patriot Nurse. Thanks for joining me today. I just need to put this one out there. Menthol cigarettes are racist. Here we go. So the FDA today has moved to ban menthol cigarettes and I believe flavored cigars as well. But the rationale for this is it could have straight out come from the plantation. And the rationale is that banning menthol cigarettes and flavored cigars is going to help to reduce systemic and institutionalized racism in the healthcare community. I'm laughing about this because it's ludicrous. But more to the point here, the FDA has said in a statement today, I want to make sure I quote this gem of a human being correctly. The woman's name, she is the FDA Commissioner, Janet Woodcock. This is an excerpt from her statements. With these actions, the FDA will help significantly reduce youth initiation, increase the chances of smoking cessation among current smokers, and address health disparities experienced by communities of color, low-income populations, and LGBTQ plus individuals, all of whom are far more likely to use these tobacco products. So basically, if you're a minority, the FDA knows better than you which choices to make consumer-wise in tobacco. People say, oh, Patriot Nurse, you're a nurse. Shouldn't you support this? No. Here's the bottom line. Your patient has the right to make a decision that you think is stupid. That's how you figure out where somebody's view of freedom really stands. Do you view that a person has the right to make a decision that you think is dumb, illiterate, stupid, you disagree with on whatever principle? Do you think they have the right to make it? That's how much of a freedom meter you've got. So, me as a nurse looking at this myself, I'm like, okay, well, if people want to smoke, they're going to do it anyway. They're going to do it anyway. All that's happening by banning things is furthering a plantation mentality. Functionally, that's what the FDA is saying by this, that they think black people and people who are whatever minority it is are too stupid to make decisions by themselves. Oh, they're going to couch it as, oh, we want to protect these vulnerable communities. No, call it what it is. You think they're too dumb. You think they're stupid. You don't respect their rights to make decisions that you think conflict with what's best. The funny thing is, when I look at yesterday, an article, and I'll link both of these articles in the description box below. When I look at these people flapping their traps, Erica Sward, National Assistant Vice President for Advocacy at the American Lung Association, alphabet soup. When you combine high rates of smoking with systemic racism in healthcare systems, you have a tremendous health disparity, says Erica Sward. Both the Centers for Disease Control and Prevention and the National Institutes of Health recently announced plans to address structural racism in healthcare. You should be paying attention to this. So here's the deal, guys. I have talked about this for a long time. This is one of the reasons why I teach classes. This is one of the reasons why I teach them in person and online. I want to empower people to care for themselves because of this stuff right here. Make no mistake about it. This is not beneficent. This is completely control-oriented. These people think they own you and me. They think they own us. They're going to tell people what's best for them. They're going to ban things that they view are not in your best interest. Total plantation mentality. But for them, you have to understand that these people at these alphabet soup medical organizations like the American Lung Association, CDC, FDA, NIH, let's go right on down the list. All of the organization groups that are comprised of a bunch of letters for doctors and nurses, these people are not primarily healthcare providers that happen to have political interests. Turn that away. No. These people are primarily politicians that happen to wear white coats. That's how this works. I've spoken about this in the past, but this is functional proof of what you're seeing here. These people are using their power to try and coerce behavior out of different groups while saying they want to protect them. You want to talk about some institutionalized racism in the healthcare system? Take a look at the Tuskegee syphilis study. Oh, there happen to be jabs associated with syringes and needles and that. We can't talk about that, can we? No, this Tuskegee syphilis study was completely unethical. Basically, a bunch of black men were injected knowingly by healthcare providers with syphilis to watch how it moved in the black population. And the way that they did it was to provide them free access to things like, screenings, healthcare, blah, blah, blah. Does this sound familiar to you? When people talk about institutionalized racism, the best example that we have of this in the healthcare industry is perpetuated at the hands of government-run and mediated healthcare. The Tuskegee syphilis study, but also I forget what the name it is. I think it's the the Indian Health Service. Like, there were women who, up until quite recently, I want to say it was in the 70s and 80s, were forcibly sterilized against their will, obviously, by these government-run organizations providing healthcare for a free or universally accessible cost. So, folks, these people are tipping their hand. They are the people at the helm of these alphabet soup organizations. They have a very clear outline of what it is they want to do, and it is not science-based, it is politically based. They are leftists. They are dedicated to their cause. They might as well be the Politburo with a stethoscope wrapped around their neck. This is not about serving patients. This is definitely not about patient advocacy. The bottom line is, as a nurse, we're taught to help advocate for our patients. I don't care if my patient decides that whatever intervention it is that I think is in their best interest, if they decide they don't want to do it, it's not within my purview to force it upon them. It's not within my purview as a nurse to make that decision for them. A, that's unethical, and B, it's insanely arrogant. But that's exactly what these people in Washington are doing. And it would be something as ridiculous as menthol cigarettes or Swisher Sweets, flavored cigars, whatever the case may be. But the point is still there. These people view their patients as slaves, as serfs. And if you think that you're going to, as a conservative or as a freedom and liberty-minded individual, get equal and fair treatment under these people, you are sorely mistaken. These people exist to push their political agenda, and they'll legitimize it under the veneer of medically sound intervention. This is ridiculous. But it's so good to know. It's so good to know. I feel so encouraged knowing that the FDA is going to be tackling institutionalized racism and blah, 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 blah within their purview. If they were really smart about it, which they're not, but if they were, they would own up to the fact that they overwhelmingly have been the greatest perpetuators of rights abuses and institutionalized racism, legit, within the history of healthcare in the United States. The institutionalized racism that has been proven definitely with the Tuskegee syphilis study, but also with the Indian Health Service forced sterilization of women. It's been perpetuated not at the hands of the tobacco industry, but definitely at the hands of government. So, think about this, folks. As the days move forward, a practical step here, as the days move forward, we need to be self-sufficient as best as possible. You need to own your health. You need to have a background in simple things like assessment and being able to figure out what's going on with this person's respiratory system and their digestive system and how can we mitigate these things. Guys, you need to have these functional skill sets, because more and more as we go down the pike over the next few years, this is laughable right now, but this is the tip of the iceberg. These people are wicked. These are wicked people. They exist to get their agenda pushed forward, and they don't care about what's right and wrong. They don't. Their right and wrong is transient and based on whatever prevailing winds of sociological acceptedness are catching their sails at the time. We have to be skilled in caring for our families, because I do not think that we are going to get a fair shake in the medical industrial complex of the future. I hope you enjoyed the video today. If you did, I hope you'll subscribe to me here on YouTube, Patriot Nurse. You can also support me on Patreon, Subscribestar, cryptocurrency, and PayPal. I got links down below. Take my class, guys, if you haven't already. It's 4 hours. It's $129 online. You can find that at ThePatriotNurseAcademy.com. If you want to train with me in person, also I have classes available all year round. You can find that full schedule at ThePatriotNurse.com. Be self-sufficient, guys, as best as possible. Unhook from these people as reasonably as you can, and own your healthcare in every way that you can. I hope it was helpful for you. Have a great weekend, y'all. For now, it's Patriot Nurse signing off, and I'll see y'all later. Mwah! Bye.